We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. WHO has been assessing this outbreak
An epidemic is when there is an outbreak of a disease in a particular area. When COVID-19 first came to be, it was concentrated in Wuhan and then in Hubei province and then in China, so there was an outbreak in a concentrated area. But then COVID-19 began spreading rapidly all around the world. And now there are over 100 countries in which there is COVID-19, not only from travelers from China and other hotspots, but also that are spreading in the community, person to person, all around the world. At that point, it is a pandemic and not just an epidemic. Words matter. It's important that we call it for what it is. Public health experts, including myself, have been saying for weeks that COVID-19 is a pandemic. Calling it a pandemic does not refer to the degree of the severity, but rather it refers to the degree of the spread. And at this point, COVID-19 matches that definition of a pandemic, and it is a call to action for everyone all around the world to be vigilant and to be aware that COVID-19 is a pandemic that could claim lives, and that does claim lives. What is the most concerning is if many patients get sick all at the same time and will overwhelm the limited capacity of the existing healthcare system. That's particularly the case for countries that have limited healthcare already. But even in countries with very well-developed healthcare systems like the US, we could still be easily overwhelmed if there is a sudden influx of tens of thousands or hundreds of thousands of patients who need intensive care. We just simply don't have the beds, we don't have the ventilators, we don't have the supplies for these patients. That's why prevention and mitigation is so important. In the beginning of the COVID-19 outbreak, countries started imposing travel restrictions as a way to delay the introduction of the virus into their country. At this point, these travel restrictions are not going to be helpful because COVID-19 is in so many different countries, and it's not just a matter of containing people from entering the country, but rather it's about preventing the spread in the communities. And so a different approach has to be taken.